An unseasonal spike in respiratory illnesses. Norton Healthcare is seeing it. WDRB's Darby Bean reports more than double the number of patients are being admitted for RSV.
There's no question that we have seen a spike.
Dr. Scott Bickle talking about a spike in RSV cases.
Both in the numbers at pediatricians' offices and in the number of children presenting to the hospital with RSV.
Bickle says in the past 3 weeks, Norton has seen more than 200 hospital admissions for RSV. That's more than double compared to the same time last year when hospitalizations were at 97.
RSV can get scary fast.
Michelle Walsh says her son Seth was recently diagnosed with RSV after lacking an appetite, running a fever, and having a bad cough.
He was coughing like every couple minutes, and it was like a harsh cough.
She's also heard from other families with recent cases.
Their little kids have respiratory issues where they've had to have breathing treatments multiple times a day.
Seth is a 5-time cancer survivor and is no stranger to Norton Children's. Trying to stay healthy and taking precautions is part of his daily life.
He is back at school, but he was out. It was a rough probably 9 days that he was really sick.
Bickle says parents should keep in touch with their kid's pediatrician, and if symptoms progress to shortness of breath or not eating or drinking much at all, an ER trip may be necessary. Experts say the peak season for RSV is typically not for a few more months, and unfortunately, Bickle says seeing more cases now doesn't necessarily mean this won't be an issue this winter.
We might get over this initial spike and see a little bit of a downtrend, but my suspicion is we'll continue to see some levels of cases, throughout the winter.
Bickle says many kids will recover after a week or two with fluids and rest, but it's important to know the signs and symptoms. Ways to prevent the virus include regular hand washing and disinfecting household items. In Louisville with photojournalist Emily Evans, Darby Bean, WDRB News.
While RSV is typically talked about regarding babies and children, adults can get it too. Dr. Bickle says people over 65 with conditions like COPD or heart disease can also be at risk.